Hey folks, so today we're discussing an important, rather a very important topic when it comes to women health. So we're going to talk about PMS, which is Premenstrual Syndrome. Premenstrual syndrome or PMS is a combination of symptoms that many women get about a week or two before their periods. Most women, over 90%, say they get some premenstrual symptoms such as bloating, headaches, and moodiness. For some women, these symptoms may be so severe that they miss work or school, but other women are not bothered by the milder symptoms. On average, women in their 30s are most likely to have PMS. Your doctor can help you find out ways to relieve your symptoms of PMS. A woman's menstrual cycle lasts an average of 28 days. Ovulation, the period when an egg is released from the ovaries, occurs on the 14th day of the cycle. Menstruation or bleeding occurs on the 28th day of the cycle. PMS symptoms can begin around day 14 and last until 7 days after the start of your menstruation. The symptoms of PMS are usually mild or moderate. Nearly 80% of women report one or more symptom that does not substantially affect daily functioning, according to the Journal of American Family Physician. 20 to 32% of women report moderate to severe symptoms that affect some aspect of life. 3 to 8% report PMDD. The severity of symptoms can vary by individual and by month. So folks, watch this video till the end since we're going to talk about some really important aspects related to PMS. Let's start with the symptoms of PMS. The symptoms of PMS include abdominal bloating, abdominal pain, sore breasts, acne, food cravings, especially for sweets, constipation, diarrhea, headaches, sensitivity to light or sound, fatigue, irritability, changes in sleep patterns, anxiety, depression, sadness, and emotional outbursts symptoms. Moving further, let's have a look at the risk factors for premenstrual syndrome. The risk factors for premenstrual syndrome include a history of depression or mood disorders such as postpartum depression or bipolar disorder, a family history of PMS, a family history of depression, domestic violence, substance abuse, physical trauma, emotional trauma. Associated conditions include dysmenorrhea, major depressive disorder, seasonal affective disorder, generalized anxiety disorder, and schizophrenia. Now, let's talk about easing the symptoms of PMS. You can't cure PMS, but you can take steps to ease your symptoms. If you have a mild or moderate form of premenstrual syndrome, the treatment options include drinking plenty of fluids to ease abdominal bloating, eating a balanced diet to improve your overall health and energy level, which means eating plenty of fruits and vegetables and reducing your intake of sugar, salt, caffeine, and alcohol. Next is taking supplements such as folic acid, vitamin B6, calcium, and magnesium to reduce cramps and mood swings. Taking vitamin D to reduce symptoms. Sleeping at least 8 hours per night to reduce fatigue. Exercising to decrease bloating and improve your mental health. Reducing stress such as thorough exercising and reading. And last is going to cognitive behavioral therapy, which has been shown to be highly effective. About half of women who need relief from PMS also have another health problem, which may get worse in the time before their menstrual period. These health problems share many symptoms with PMS and include depression and anxiety disorders. These are the most common conditions that overlap with PMS. Depression and anxiety symptoms are similar to PMS and may get worse before or during your period. Next is chronic fatigue syndrome. Some women report that their symptoms often get worse right before their period. Research shows that women with ME or CFS, as it is usually called, may also be more likely to have heavy menstrual bleeding and early or premature menopause. Irritable bowel syndrome, IBS, as it is usually called, causes cramping, bloating, and gas. Your IBS symptoms may get worse right before your periods. Bladder pain syndrome. Women with bladder pain syndrome are more likely to have painful cramps during PMS. PMS may also worsen some health problems such as asthma, allergies, and migraines. So that's it in this video, guys. If you have liked the content and found it to be useful for you, make sure you hit the subscribe button and also click on the notification icon. Also make sure you share this video with your loved ones and keep them well educated and well updated about these important information. You can also follow me on various other social media platforms like Facebook, Instagram, and LinkedIn. Thank you for watching.